The COVID-19 vaccine for Canada's youngest children could be approved later this month.
Health Canada says it expects to make a decision by mid-July about whether to authorize the use of Moderna's shot for kids between 6 months and 5 years old. So joining us now is Dr. Dina, founder and CEO of Kid Crew and a pediatrician. Dr. Kulik, thanks for joining us again. So this news about Health Canada possibly approving the vaccines for children in that youngest age group could be coming soon. How do you feel about this, and what's your message to parents who might be on the fence?
I think families have been eager to get vaccines into their young children for a long time. If approved, it would be approved for kids 6 months to 5 years, and of course 5 years plus, they're already approved. I hear from a lot of families that they're very eager to get their kids vaccinated. They want to feel more confident in the summer, going back to school, where we keep hearing the rise of Omicron strains, the rise of COVID, and a lot of people want to protect their kids.
What are you seeing these days at your clinic, Dr. Kulik, when it comes to children under 5 and COVID? I mean, are you seeing any uptick? Are you seeing significant caseloads? What's your experience been?
Yes, it has been very, very busy at Kid Crew over the last number of months. Many kids with confirmed COVID and their families as well. Lots more kids, many more kids that are sick with what is probably COVID, albeit the testing seems to be less accurate as we go along. But yes, many, many sick children over the summer.
Dr. Kulik, I'm not sure if you know this yet, but obviously there's talk about new vaccines being developed that are more geared towards Omicron and these new variants that we're seeing. For these children or mini-dosed vaccines for these younger age group of kids, would that be the original formula of the pediatric Pfizer and Moderna, or would it incorporate some of this new stuff to combat the new variants?
Yeah, that's a great question. Luckily, happily, these new vaccines were created in the Omicron era, so they are more targeted towards the newer strains versus the ones that adults have been getting all along that were created very early on and haven't really changed since the beginning. So yes, these are more targeted to the newer strains and therefore would be more effective against the new strains now and potentially to come as well.
Now, Dr. Kulik, I know you're dealing with a lot of COVID right now, but I also understand that you're seeing quite a bit of hand, foot, and mouth right now. I think we talked about it a couple of weeks ago, but it seems like the situation is getting worse.
We've been seeing so much hand, foot, and mouth disease over the last number of months. I spoke about it in the media and social media a few months ago, this rise. We've never seen this much hand, foot, and mouth in this season. It's usually winter and fall. I do still believe it's related to Omicron in some ways, but yes, we've seen really, crazy numbers of cases with this, and not just at Kid Crew, but across Ontario, across Canada. My colleagues in the States are seeing the same huge numbers of this rash.
Dr. Kulik, remind us again how exactly hand, foot, mouth spreads, and what's kind of the isolation period if your child does present with symptoms of it.
So typically symptoms last about 3 to 5 days. Most typically kids will get fever and sore mouth. Later they get a rash, most classically on the bottom of the feet, the palms, around the mouth, but it could be head to toe. Not usually itchy or painful, but the mouth for sure is very uncomfortable. And it usually spreads by droplets, touching things that other people have touched. But this seems to be so much more common, more prevalent, more contagious. I wonder if this particular strain might be being spread airborne as well.
And is there a treatment for hand, foot, and mouth, Dr. Kulik, or is this something you just have to sort of get through?
Yeah, symptomatic treatment. So things like acetaminophen or ibuprofen for pain and for fever, soft, cold foods and drink, popsicles, ice cream, yogurt, yummy stuff like that because the mouth hurts, and just pain management and making sure kids stay hydrated.
Right.
Yeah, sounds like a diet I could live on. All right, Dr. Dina, founder and CEO of Kid Crew and pediatrician, thanks so much for your time again. Take care.
Thanks, doctor.
You too.